Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We've got Stephen back in here with us today, and this will be Stephen's second adjustment here at Advanced Chiropractic Relief. They came in yesterday with his son from Nashville, Tennessee, and both of them are getting adjusted twice a day now for today and tomorrow. And Stephen came in here with a very common complaint that we see in here, which is lumbosacral radiculopathy. A lot of people want to know what that means. Lumbosacral radiculopathy is a pain that originates in the lumbar spine or pelvis, sacrum. So lumbar, sacrum, lumbosacral. And then radiculopathy denotes it pinching the nerve roots going all the way down into the legs. That can come in the form of pain, either sharp shooting pain, which is lightning bolt type pain going down there. A lot of people call it sciatica. Those are interchangeable terms. In Stephen's case, it went all the way down into his left or his heel. And he had been told, I believe you told me this, that you'd been told you had plantar fasciitis.
Right.
And it's called plantar fasciitis, not fasciitis like the Good Feet store here in Houston calls it all the time. Fasciitis just is an inflammation of the fascia, which is the outer covering of the muscles. It's a myofascial tissue. So whenever it gets inflamed, it's fasciitis, inflammation of the fascia, which is the covering of muscles in the feet. Now, there's a clinical way to discern whether the pain going down into his heel is coming from the lumbosacral spine or coming from his feet. Because I didn't adjust his feet yesterday, but I did adjust his lumbosacral spine, and his heel pain went away pretty quickly, you told me.
Yeah.
After that. And you've been dealing with that for how long now, Stephen?
Probably about 20 years wearing.
20 years.
Yeah, wearing different orthotics or.
And you still had the pain though?
Yeah, Birkenstocks, anything with arch support I've got to have.
Right.
So.
And you know, a lot of doctors will tell you have plantar fasciitis because they sell orthotics or heel lifts and all those things, but Stephen's been wearing those for years and he still has the heel pain. We did one adjustment on him yesterday in his entire spine all the way down to the lumbosacral region, and his heel pain went away within probably 10 minutes, right?
Yeah. Yeah.
So clinically, you can tell whether the pain is lumbosacral in nature or coming from the foot itself. If I had adjusted his lumbosacral spine yesterday in my adjusting procedures and he didn't have any relief down into his heel and into the bottom of his foot, then I would be more inclined to say that he did have plantar fasciitis. But when those clear up, when you give the patient an adjustment of those regions in the lumbar spine and pelvis that are where lumbosacral radiculopathy starts from or emanates from, and they get better, that tells you it's lumbosacral radiculopathy versus plantar fasciitis. Kind of a differential diagnosis that we do on the first visit. This is his second adjustment. He came here complaining of upper back pain, mid back pain, lower thoracic pain, low back pain that went all the way down to his right leg and feet, and bilateral heel pain, right?
Correct.
And you had rib pain bilaterally as well, coming around those rib cage. So we did his history and examination yesterday, and I also clinically come to the differential diagnosis, provisional diagnosis of whether they have now lumbosacral radiculopathy can be caused by vertebral subluxations, which are biomechanical improprieties or misalignments of the vertebra in the sacrum. They can be caused by herniated disc, which is where the nucleus pulposus is compressed and squishes out the side of the annular fibers and pinches on a nerve. That's a herniated disc. They can be caused from a bulge disc, which is where you're getting compression of the disc that just bulges out and doesn't herniate completely. You can have spinal canal stenosis, which is a narrowing of the actual spinal cord. Now down the lumbar spine, the spinal cord flares out like a horsehair's. It's called phelum terminale. It starts at L2 and goes all the way down into the L5 sacral region where the nerves kind of flare out and look like a horsetail. It's called phelum terminale. And it's still the same central nervous system that comes into those areas. But if you have spinal canal stenosis, it can encroach on those horsehair, phelum terminales, sometimes creating a condition known as cauda equina syndrome. And that's a much more severe form of lumbosacral radiculopathy or stenosis, because you're actually cutting off nerve supply to your bladder and bowels. So that's when you lose bladder and bowel function and can cause foot drop, weakness in the legs. You can also have numbness and tingling down your legs and your feet, which is called paresthesia. This is kind of a clinical seminar here that I'm doing today. But I try to approach every single patient. I do approach every single patient knowing the differential diagnosis that I need to look at, and then coming to a clinical decision based on my history, examination, and treatment of the patient. So let's see how we show them how we do number 2 today then, Stephen. I'm gonna have you close your eyes and bend your head forward and backwards for me. I see you've got a detailed explanation of your condition when you get home. Okay, his head's a little forward, no to the right. He's a self-confessed side sleeper for a lot of his life. Most people are, and that's what I see. His pelvis is translated left a little bit. He has a little less room over here between his pelvis and his arm. There's this right side, is a little more room over here, so his pelvis is translated left on the x-axis. This being Stephen's second adjustment, we're going to do the ring dinger first, so let's lay on your back here. Slide up this way about an inch. There you go. Perfect. Did you guys move over to this height last night?
Yes, we did.
Is it better?
Yeah, it was
Okay,
good.
Did they give you a rate?
Yeah.
Good.
Yeah.
If you're coming here from out of state or out of the country, we have a contract with the Hyatt Regency North Houston IAH Airport, Hyatt, for $79 a night for our patients and doctors who are coming in to take our seminars. Slide down maybe about there you go, perfect. Alright. And we're only like 8 to 10 minutes from the airport, and the Hyatt Regency North Houston has a shuttle that can pick you up at the airport and bring you to the hotel and get you checked in, and you just walk across the street for your treatment. Did you guys walk over here this morning?
Yeah. Yep.
Not that bad, is it?
No.
Okay, keep your teeth together for me, Stephen. Yes, sirree. Getting easier. Didn't hurt me a bit. There we go. I'm not checking their knee reflexes to see if I paralyzed them, because that's not going to happen, even though y'all might want that to happen. They've been waiting years to see me paralyze somebody. But I checked that so that I have a reference for my initial exam from checking their patellar reflexes on the orthopedic neurological examination. Do you see how they've improved there already too?
Yeah.
They're jumping more. Okay, let me help you. And that's not a possible hermit sign either, like some orthopedic surgeons have asserted. It's not a pathological reflex. When you do the kind of work that I do, you take shots, criticism from everywhere, including orthopedic surgeons who don't like us fixing people before they get a chance to operate on them. In fact, we had a patient come in earlier this morning, and she had been told by her MDs that she had osteoarthritis. They didn't say osteo even, they said arthritis, scared her to death. And then she said, well, he told me I also had spondylosis. She was like freaking out because the MD had told her those things. And I said, did they recommend you have 3 injections? And if that doesn't work, surgery? Yeah, how'd you know? Because that's their protocol. The arthritis that she had was degenerative joint disease, which is osteoarthritis. Did I hurt your low back at all that time, Stephen?
It's on this.
Tight on that side still?
Oh, I get the elbow.
Mm-hmm. That's what happens when you don't put the lotion in the basket. You have to know me to get that one.
We're big movie fans.
Yeah. There's probably even some of our crack addicts have watched that movie. It's a pretty common one. Silence of the Lambs. Put the lotion in the basket. What is it? I don't remember the whole line.
Just put the lotion in the basket.
Or you get the water hose again.
Yeah.
That's it. I just say, put the lotion in the basket, feel better down here. I'm gonna stick the elbow in. All right. We got a weird sense of humor, I know. There we go. Okay, let's turn you on your back, Steve. Yes, there you go. Good. Yep, slide down a little bit more. Put both arms out, palms up. There we go. There. You know what? Slide up that way just a little bit for me, Stephen. There you go. That's it. Yep. Okay, you can relax your hands right there. Now when I do this leg pull adjustment, I'm actually getting movement from the ankle, knee, hip, all the way up into the lumbosacral spine. So this often helps out patients who are suffering from lumbosacral radiculopathy as well. There we go. Yes, sir. Okay, let's hit you face toward the bend. There we go. That's it. There we go. Yep. Okay, let's stand you up over here in front of the mirror again. Alright, let's pull these guys here, straight this way and then like this. There we go, okay. Try that same move again, Stephen, see if this feels any easier yet. Better range of motion, that's for sure. His
Yeah.
posture's already improved. Look how much we opened that up.
Wow.
Pretty cool.
Good. Good.
So Stephen, you have been to other chiropractors before you came here.
Yeah.
And you said that they'd helped you.
Yeah.
What would you describe to our viewers is the difference between my technique and what you've had previously?
Seen about 3 different chiropractors through the years, and it's really totally different. I mean, the decompression is obviously something that's not common.
All right.
And that was one thing that when I saw that, it really
Kind of
hit with
instinctively
me.
knew,
It
huh?
looked, I was like, man, that makes sense.
Yeah.
Won't say that I wasn't a little nervous first time,
Right.
but it
Everybody
was, it absolutely made sense on the decompression side, because I used to have one of the tables you hang upside down.
inversion
table.
tables.
Yeah, and those would help.
That helps somewhat, yeah.
Other than, you had,
Where you're not getting an adjustment though.
No, but-
This is not just spinal decompression. This is a Y-axis adjustment.
right, so, but no, it's really night and day different.
Yeah.
I mean,
It's
I
a lot
love it.
different than that twisty side move on your lumbar
Right.
spine, huh?
Right, it's definitely.
And that, do you feel heel pain on either heel right now?
No, not right now.
So again, what that tells you is when you adjust the spine, the lumbosacral spine, and you get relief in your feet, the heel or the bottom of the foot, that is lumbosacral radiculopathy versus plantar fasciitis. If his pain had not gone away, then that would lead me more to the clinical decision of he had plantar fasciitis rather than lumbosacral radiculopathy. Now, a lot of that girl I told you about came in earlier today. They had done MRIs on her, myelograms, and x-rays on her, and had her scared to death because they saw herniated disc in the lumbar spine. In my opinion, I mean, MRIs are good, but if you do a thorough history and examination, I think they're overused a lot of times too, and they're used to really scare people into having more invasive medical procedures such as injections or surgeries. Because that's their game plan, is to do 3 injections. If those 3 injections don't work, they want to lay you on the table and cut on you. So anyway, chiropractic is all natural. We don't do any invasive procedures, no injections or no surgical procedures. It's analyzing and determining biomechanically what is going on with the spine and if that is influencing the neuromusculoskeletal system, which in most cases, just like Stephen's, it is creating what's called LumboSacral radiculopathy that's coming out of his lumbar spine and pelvis down into his legs, and that's what we're working on for him this week to get him better.
Thank you, sir.
Yeah, thank you for sharing your stuff with everybody today.
No problem.
This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, with Stephen from Nashville, Texas. We'll see y'all soon.
Tennessee.
Tennessee. When I say Texas, I got
Yeah.
Texas on the brain.